Hello everyone. Today, we're diving into the world of a medication called Metformin, commonly known by its brand name, Glucophage. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Metformin, often recognized by its brand name Glucophage, is an oral medication primarily used to manage blood sugar levels in individuals with type 2 diabetes. Metformin belongs to a class of drugs called biguanides. It works by decreasing glucose production in the liver, increasing the body's sensitivity to insulin, and enhancing glucose uptake and utilization by muscles. Metformin was first approved by the FDA in 1995 and has since become a cornerstone in the management of type 2 diabetes. It's often prescribed in conjunction with diet and exercise to improve blood sugar control. Additionally, metformin has shown benefits in reducing the risk of diabetes-related complications and is sometimes used off-label for conditions such as polycystic ovary syndrome, POS. Warnings: Metformin comes with its set of precautions. One of the most serious risks is lactic acidosis, a rare but potentially fatal condition caused by the buildup of lactic acid in the blood. This risk is higher in individuals with kidney or liver issues, severe infections, dehydration, or those who consume excessive alcohol. Metformin is not recommended for those with severe renal impairment or metabolic acidosis. It's crucial to stop taking metformin if you are undergoing certain radiologic studies involving iodinated contrast materials, as this can increase the risk of lactic acidosis. Before taking this medicine. Before starting metformin, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Those with kidney or liver diseases should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of kidney function is advised, as metformin can affect renal health. You should not take metformin if you have severe kidney disease, diabetic ketoacidosis, or if you are undergoing treatment with contrast agents for radiographic studies. Before starting the medication, inform your doctor if you have ever had heart disease, liver disease, or if you drink alcohol very often. It's also important to let your healthcare provider know if you are on a low-sugar or low-calorie diet. If you are scheduled for surgery or certain X-ray procedures with injection of dye, inform your doctor as you might need to stop taking metformin for a short time. Side effects: All medications can have side effects, and metformin is no exception. Some individuals might experience gastrointestinal issues such as nausea, vomiting, diarrhea, stomach pain, or loss of appetite, especially when first starting the medication. These side effects often subside as the body adjusts to the drug. However, if they persist or become severe, it's important to consult your doctor. A rare but serious side effect is lactic acidosis, characterized by symptoms such as muscle pain or weakness, numb or cold feeling in your arms and legs, trouble breathing, stomach pain, nausea with vomiting, slow or irregular heart rate, dizziness, or feeling very weak or tired. If you experience these symptoms, seek medical help immediately. Metformin can also cause low blood sugar, hypoglycemia, when used in combination with insulin or other diabetes medications. Symptoms of hypoglycemia include headache, hunger, weakness, sweating, tremors, irritability, or trouble concentrating. It's essential to manage blood sugar levels closely and be aware of signs of both high and low blood sugar. Interactions: Metformin might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Medications that can affect kidney function, such as certain diuretics or blood pressure medications, may increase the risk of lactic acidosis. Additionally, corticosteroids, diuretics, and other drugs that can affect blood sugar levels may require adjustments to your metformin dosage. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking metformin. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The usual starting dose for metformin is 500 mg taken twice daily or 850 mg once daily, with meals. Depending on how you respond to the medication and based on your doctor's advice, the dose may be gradually increased to a maximum of 2,000 to 2,500 mg per day, divided into multiple doses. Extended-release versions of metformin are also available, which are typically taken once daily with the evening meal. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid. While on metformin, it's advisable to avoid excessive alcohol consumption, as this can increase the risk of lactic acidosis. It's important to stay hydrated, especially during exercise or in hot weather, to prevent dehydration. If you experience gastrointestinal side effects, try taking metformin with meals to minimize discomfort. FAQ. Many wonder about the age restrictions for metformin. Currently, its safety and effectiveness in children under 10 years of age are not well established. For older children and adolescents, metformin can be prescribed, but the dosing and monitoring may differ from adults. Always consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of metformin. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.